Kia ora koutou, te lauwha. Good afternoon. And that was a very nice welcome, thank you. I do have support. It was just that my EA has been away for a few weeks, and so actually, yes, I can even use Lotus Notes. How's that? Yeah, I am learning, yeah. So you can keep teaching old dog new tricks, I think. Okay, now I was really delighted to be able to give you a 15-minute presentation, and I'm really hoping that I'll do due diligence to the newly stood up directorate and the work of the directorate. Now, how do I get this one here? Okay, yeah. The big one. Okay, so this is a brief oversight of the work of the directorate. We are responsible, and a newly formed team formed from different parts of the ministry is responsible for providing strategic oversight and end-to-end activities and functions for disability support services in New Zealand. Other agencies, as people know, provide education, employment, and housing support, and all sorts of other agencies are involved in this hugely, I believe, valued sector from my point of view. This includes strategy, policy, service planning, and transformation, commissioning for outcomes, and service improvements. Now, example of that kind of work is the work that's coming out of the Mid-Central Systems Transformation Prototype, Mana Whakaha, and that's a cross-agency program of work, mainly funded through DSS, but also through MSD, and that's the philosophies are coming out of the Enabling Good Lives philosophy. It's early days, but we're going to be advising the government later this year on how we could roll out the actual Mana Whakaha model or parts of it, and so that evaluation will happen later on this year, and I'm sure a lot of you will be waiting to see what comes out of that. We commission and fund for outcomes just over $1.3 billion worth of funds to 980 providers, and a lot of you are in this room, and many are NGOs, and we have 1,280 actual contracts with people within New Zealand. We have our team of staff in Auckland, Hamilton, Wellington, Christchurch and Dunedin, so we are all over New Zealand, and in my nearly 3 months here, I haven't actually been out to the regions as yet, but I'll be doing so. I've got some slides that represent what the disability services have been experiencing in terms of growth and numbers in the last few years, but what I think you'd be most interested in is the work that we're doing on strategy, and that's a strategy about, actually, we all know that we have constraints. You know, we are fiscally responsible for public funding, and we're experiencing some constraints. So what I'm going to be doing is going out to the regions, and I'm going to be doing a big listen, because actually we as a directorate have to and need you guys. We need your support, we need your feedback, we need to work together to ensure the best outcomes for disabled people. Now, at this stage, I'm going to let you know I have a conflict of interest. I have lived experience. I have a grandson who is profoundly disabled, just to put it on the table, just for your information. Anyway, the next slide is going to show you how our numbers are changing, and it's just for your information, it's for interest. It gives us the reason why our numbers are growing. So that the top, do we have a little light here? No, it doesn't matter if we don't. The top line signifies community support. So these are people that are living in the community, being provided with community support. And the number of actual overall clients have grown by 2.7% each year over the last 5 years. 0.2% of those are residential, and 3.4 are community. So to me that sort of shows, hey, this is quite good. More people are living in the community, and that's always been the strategy. The contrast, though, is with the overall population growth in under 65s of 1.6%. So as you can see, we're growing at nearly double the population growth in terms of disability. And that's just over the same period. And so these are the guys that crunch the numbers, believe that we have a client volume of 66% greater than the population increase. So we've clearly got other drivers at play. All right, so where is the growth coming from? And I thought you'd be really interested to see this, because in the last few years, the number of new clients, as I said, community for under 5s and 5 to school leavers have both grown by approximately 50%. For the 5 to school leaver age group, the increase in new clients from 1,124 in 2014 to 1,740 in 2018 is almost entirely attributable to clients with ASD. So if you remember, like me, if you've been in the sector for a long time, in 2014 there were policy changes where the disability support services supported children with ASD. So, and that was right and proper, those policy changes. So you can see where some of the growth is coming from. So this final slide gives you a bit of an indication of the annualised cost of client packages of care, which has increased on an average of 5.6% each year over the last 5 years. Residential packages have increased by an average of 3.9% each year, and community packages have increased by 8.5%. Now this reflects both an increase in the volume of services being purchased and also those services being purchased at higher prices. There's been a number of things that have happened in the last few years. Pay equity, obviously we're looking at the numbers at the moment, different services, enabling good lives. There's been some really good things happening within the community, but at the end of the day, we do have a growing amount of people accessing services. So I look at it as an opportunity, and as I said, the opportunity is to work with you. But not only to work with you, is to work cross-agency with other government agencies, and we're forming those relationships. What we are doing initially, and I'm currently working on the terms of reference for it, is we don't want to work in isolation. However, we do need to produce a strategy in order to move forward. And so I'm currently working on a terms of reference, and that terms of reference is going to be put out to the community, and I'm looking for 3 to 5 disabled people or family whānau to support or sense check the strategy work that we're doing. So this will be work. We'll be probably pulling together at least once a week, either by VC or face-to-face. It'll be a paid position, and we would expect challenges, we'd expect really good feedback, but I need to sense check the work that we're doing. We're still looking at the numbers, because these are high level, so we still need to find some of the drivers for what we're experiencing. But you can see that it's pretty up there, and as much as I understand that there were a number of comments going through Facebook after some media attention after Easter, funding has not been cut. We're not intending to cut funds, and the government is committed to ensuring disabled people and whānau have the opportunity to live independently in New Zealand with access to the support and services that they require. Now, I'm not sure how we're going for time. Does anyone know? Yeah. 5 minutes, okay. So do we have time for any questions? Because I mean, I could continue here, because you know, you can't take me anywhere, I can just go on all day, because I am actually very passionate about this sector. And it's an amazing thing for me to be engaging with you all again, which I do on a daily basis, but I just thought it might be nice for you to be able to ask some questions.
Thank you for your presentation. I'm curious to know how inclusive is your measure of disability clients and community versus residential care. Does that include people that are looked after by NGOs, who employ field officers, like for MND or MS or something like that? Are they included in those figures?
Yeah.
They are.
The community clients are not on the residential figures unless they are in residential care, but for the community they are. If they're receiving disability support services, they are part of those figures.
So even if those disability services are supported majorly by the community rather than the ministry?
If the people in the community being supported have gone through their NASC, Needs Assessment Service Coordination process, and have had an assessment and are receiving disability support services, they're included in those stats.
That excludes a lot of people.
Yeah. Okay, so we need to start getting a handle on that kind of information,
True.
and we don't have it, to be fair, yeah.
No.
So, no, that's a good comment,
Okay, good
yeah.
stuff. Thank you.
My name's Joanne. I'm actually from Autism New Zealand, but I'm actually also autistic. I'm very interested. I'm not surprised by the ASD figures at all.
Yeah.
But my complaint has always been to the Ministry of Health that there's no data. There's not enough data around ASD at all.
Yeah.
And I think that has to change. I've been saying that for 5 years. I don't know how long I'm going to keep saying it. It has to change. We need that data.
Yeah. So you've raised a really good point about the data, particularly about the ASD data. So as I said, this is at a real high level, but we are starting to get better information and better data. So what we've done is we've pulled 3 systems together within the Ministry of Health and used a system, and I'm not techno at all, called Click or Quick or something like that, and that's pulling this information together. So every month we'll be getting richer and richer data from our systems that then will hopefully influence our strategy going forward, because we know that support is needed to assist disabled people in New Zealand to live well at home and participate in the community. And as I said, it's about enabling good lives and the philosophy behind that. So we need to look at how we manage the pressure of what you see and what you saw in the numbers and the growth and demand. But as I said, also, we need to work together on that and the strategy, because we can't work in isolation. And so therefore I was really pleased to be coming to this forum this afternoon. Yeah.
Hi Adri, it's Jerry here.
Hi, Jerry.
You mentioned cross-agency work.
Yeah.
Have you got an idea of how you might shape that up?
To be honest, I'll be waiting for your ideas. Already before I got into this position, we had the Disability Action Plan, which was influenced very strongly and maybe actioned by the DPOs, and the strategic leadership of that was the ODI, Office of Disability Issues, and there are 3 actions in that plan that pertain to disability that absolutely we'll be working with and cross-agency with. But apart from, I'm open, because, yeah, absolutely open. And even if people have suggestions of what might look really good in one area, because there's pockets of innovation that happens, and it's you guys that cause these pockets of innovation. So I'm really interested to hear about that when I work my way around with the big listen. Yeah.
Because there's quite big systems
Yeah.
outside of disability that impact on disabled people's lives
Yeah.
and marginalise them.
Yeah.
So it would be good if those systems
Yeah.
contributed to the overall
Yeah.
solution.
So we want to engage with education. We already engage with MSD. We already engage with these organisations, by the way. It's just how we do it and how we work together. With Housing New Zealand, that appears to be quite an issue within the disability community. So how do we support in terms of policy and future with things like that? So all really good work that we intend to be doing. Don't forget it's a long-term strategy. We're not going to do this in the next 3 months.
Hi, my name
Hi.
I'm Lisa Foster. I'm with Rare Disorders New Zealand, and just thinking about the data issue. So obviously with rare disorders, that would include some forms of autism. Fragile X is a disease that actually has an autistic component.
Yes.
But it sort of falls in and out of disability depending on diagnosis and complex situations. So for rare disorders, it's a particular need that isn't really being addressed in New Zealand, unfortunately. So it's just a couple of things really around that, is to raise awareness around that in the room. And also with the data, there is a coding system called SNOMED, which,
Oh, yes.
yeah, so that's only being rolled out through Indici in the Midlands at the moment. And there's a GP conference starting on Thursday. I'm going to have a conversation with the person who's rolling that through in the DHB. I think it's Pinnacle Ventures. But is there any plan to have SNOMED implemented, given that it will provide better data, including data on a registry for rare disorders?
I've always been really interested in Indici, which is a patient or client management system that some of our PHOs and primary care organisations are investing in because of exactly that. We don't have that within our Socrates system, within our systems. However, if that's and I understand that 3 DHBs in this region are looking at that as well. So I'm really hoping or hopeful that nationally we can create some consistency with that, because that will give us better data. We can't wait for that to happen. Again, that's a long-term strategy, but it certainly gives you far more robust data. So I don't have an easy answer for you. Yeah.